All right, if you don't like maths, don't stay in this particular video, just scroll to the next video. Let me explain something to you about atorvastatin 20 milligrams so that you understand something. This is pharmacokinetics, right? Now in pharmacokinetics we have ADME, right? Absorption, distribution, metabolism, and excretion of medications, right? Yeah, so let me explain something to you now. When you take atorvastatin 20 milligrams, which is a high intensity um statin, right? Don't forget what I said about atorvastatin. I've done this video, like check my videos, just watch. Let's leave that one, sha. So atorvastatin is a medication used to lower cholesterol level, especially the LDL, which is what they call the bad one. I don't even consider it as bad, but they call it the bad cholesterol, right? It's called low density lipoprotein. It works by blocking the HMG CoA reductase enzyme, right? This enzyme is a rate limiting enzyme that helps in the production of what's it called, of cholesterol, right? But that's not where I'm trying to go to now. When you take a particular medication orally, right, it is being absorbed from your intestine. Now when atorvastatin is absorbed in your intestine, right, it goes directly to your liver for metabolism. You understand? In metabolism, a drug is biotransformed, right? Some become more active, some become less active. In fact, during metabolism, two parts of the medication is usually created, right? Both the active and inactive parts. So let me write it. So we have active parts and inactive parts of every medication in metabolism. Just know that part. Now, in atorvastatin, when it undergoes metabolism, right, what usually happens is this: only 14% becomes active, only 14% goes into systemic circulation. The other 86% is practically useless, if that makes sense. Now imagine you're taking a medication from 20 milligram of atorvastatin. What is left is just 14%. So what is 14% of 20 milligram? I did the calculation before I started this video, so I don't have to bore you the details, right? It's 2.8 milligram. So 2.8 milligram is the amount of atorvastatin that is left after the drug visited your liver for metabolism. So you now see that it's already small. From 20 milligram is already small. Imagine you're taking 5 milligram of atorvastatin. How many do you think will reach your systemic circulation? Now, when this particular medication gets to your bloodstream, right, which is systemic circulation, right, there's what's called protein binding. Now, protein binding is usually one of the things that are responsible for how long a particular medication stays in your body. That means the 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 concentration of the drug in your body, if that makes sense. Now, atorvastatin is highly protein bound. That is why it lasts a very long time in your body, if that makes sense. So it is 98% bound, atorvastatin, where you know. Do you get it? Now, if it is 98% bound, it means that, let me use another marker. What is 98% of 2.8? Let me do it, for I've done the calculation. Is 0.056 milligram. Now, get this. Oh, do you know the binded atorvastatin is practically useless when it comes to lowering your cholesterol level? It is only this free one, this 2% that is free. That is what will go to your liver and stop the action of this HMG CoA reductase enzyme from working. Do you get it? So the amount available to lower your cholesterol level is 0.056 milligram. Even as at then, do you know that it is not all this amount that that goes to your liver and stop this enzyme from working? Do you get it? Because of several factors. Let me try to explain it if it makes sense, right? Now, the amount of blood flow is what determines how much of this 0.056 milligram gets to your liver, right? Even now, even when this particular milligram gets to your liver, right, it still have to react with the liver cells. Now we have liver cells, right? Okay, just how will I say it? This particular 0.056 still needs active proteins that will draw this atorvastatin into the cell, into these liver cells, to stop the action of this enzyme, if that makes sense. Do you get it? So even out of this 0.056, less than 0.056 gets to your liver inside your cells and stop this enzyme from working, and yet you still have a very good control of your cholesterol level by taking just this, less than this amount. Do you get it? So what usually happens is that when you finish, when this amount gets exhausted, some of this protein binded atorvastatin is also still released into your blood, and it becomes free, and the free goes back to your liver and continues to work. All right. So when atorvastatin binds to this HMG CoA reductase, it binds it for about 14 hours. You get it? So it means for that 14 hours, you there is no production or there is reduced production of cholesterol, if that makes sense. So what am I trying to say? I'm trying to say you might get like 0.02 milligram of the whole atorvastatin working every single time, and yet this amount is able to lower your cholesterol level, especially the LDL cholesterol level. What am I trying to say with all these things? Please don't take overdose of medication. If this 0.02 milligram is still very effective in lowering cholesterol level, imagine you now take overdose. What do you think will happen to your liver? What will happen to your kidney? What will happen to your... All right, so I'll see you in my next video.